All right, so this is how we would like to see your patient trauma assessment go. You will have two partners with you that are trained at your level and will do whatever you want them to do, and they'll do it correctly. So we'll say that I am dispatched to a lady that fell out of a 4-story window. So we arrive on scene. I have one patient. The scene is secure. My mechanism of injury is a long fall. I definitely want ALS, and I'm going to consider holding C-spine. In fact, I'm going to have my partner hold C-spine. I have two partners with me. One of them is going to hold C-spine. As I approach the patient, my general impression is poor. I'm going to check her AVPU. Ma'am, can you open your eyes? No response. Can you open your eyes? Still no response. So now I'm going to check for a pulse and check for breathing. Open her airway for about 10 seconds. We'll say that she has a pulse of 120 and her respiratory rate is about 16. Based on her skin signs, we'll say that she is very pale and cool diaphoretic. So we are going to put her on high flow oxygen at this time. So now I'm going to start my assessment. She's going to be transported code 3 to the trauma center based on a calculated GCS of 3. She has not opened her eyes, she is nonverbal, and she has made no movements at all yet. All right, so now I'm going to start my assessment. I'm going to check her entire head, back of her head, forehead, cheekbones, check her jaw, run her nose. I've already looked in her mouth. I'm going to check her ears, her other ear. I'm going to check inside her nose, and I'm going to check in her pupils. Okay, all that looks okay. I'm going to move down to her throat. Trachea midline, neck veins are flat, and I'm going to assess her cervical spine. At this time, her shirt is off. I'm going to visualize her chest. I'm not seeing any abnormal findings. I'm going to push, 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 and push. At this time, I'm also going to listen. Listen for her to breathe. 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 And breath. Okay, I'm going to move down to her abdomen. I'm going to palpate all 4 quadrants. Get her kidneys. All that feels fine. Come down to her hips. I'm going to push in first. Push down. I'm going to verbalize inspection of her genitalia. Going to come to her femurs. Femurs are okay. Kneecaps, behind the knee. Those feel okay. Tib fibs are okay. Her shoes and socks are also off. I'm going to run the bridge of her feet. I'm also going to check for pulses. And I'm going to see if she has any kind of painful response at all. Okay. I'm going to come back up. I'm going to check her clavicles, scapula, scapula. I'm going to check her upper arm, her elbow, lower arm. I'm going to check each one of her fingers, upper arm, elbow, lower arm. Check each one of her fingers. She has cold hands. I'm going to check her pulses. Okay, we'll say she has weak pulses. I said her pulse was 120 or something. Okay, so I haven't noticed any trauma yet. I'm going to put a collar on her, and now I want to log roll her so I can take a look at her back. So on the heads count, you got to help me out. On the heads count, 1, 2, 3. Okay, I'm going to start where the collar is at now, and I'm going to continue checking her spine. I'm going to check each one. For class, we'll stop here, but if she was truly my patient, I would keep going. I don't notice anything on her back, on her butt, on her legs. If I didn't hear good lung sounds on her chest, I would take them on her back. We're going to slide the backboard in. On the heads count, down on 3. 1, 2, 3. Okay, we're going to strap her in. I'm going to get a set of vital signs. We'll say her blood pressure is 80 over 40. Her pulse rate is 120. Skin signs still look like crap. So we're gonna, if we're the advanced students, we're gonna start 2 large bore IVs on her, get her pressure up to 90. We're gonna treat her for shock. She is showing signs of shock. So we're gonna cover her back up with a blanket. She's got oxygen on. She is supine. We can even elevate her feet if we think it's needed. Just elevate the whole backboard. And then we're gonna get her to the hospital as quick as possible. Any questions?